Megan Garza, MA, LMFT, is a licensed marriage and family therapist, certified trauma care supervisor, and American Association of Marriage and Family Therapists board approved supervisor with 20 years of experience in the mental health and violence against women fields. She is a graduate of Pepperdine University with a master's degree in clinical psychology and marriage and family therapy. She received a second master's at the University of Missouri, St. Louis in psychology. She is co-owner and therapist at Healing Reflections Therapy, Diversity, Trauma, and Wellness Services in St. Louis, Missouri. She is on the advisory board of the National Partnership to End Interpersonal Violence and is former president of the St. Louis Association for Marriage and Family Therapy. Megan has spoken at national conferences on sexual trauma and PTSD and has published and edited peer-reviewed research in the area of trauma-informed care and sexual abuse. Karen Rich, LCSW, PhD, teaches and researches in the area of secondary victimization, rape, sexual assault, intimate partner violence, and institutional responses to trauma. Her research has focused on police responses to rape victims, interdisciplinary responses to sexual assault, interpersonal violence against people with disabilities, and secondary victims of campus rape. She is active on several trauma-related boards, conference planning groups, and intervention teams on the international, national, and local level. She is pleased to be a longstanding member of the National Partnership to End Interpersonal Violence's board and practice action team.
Thanks, Pearl. Well, hi, I'm glad to be here. Now, one of the biggest questions that often gets asked is, why should I address this trauma? Like, shouldn't we just kind of leave it in the past? It was done, it was over, can't we just move on? And that's a real struggle because honestly, what has happened in the past is very much still present and active today. As Pearl talked about earlier with ACEs, with the Adverse Childhood Experiences Study, we know that the events from the past has an impact on someone's health today. And to the extent that there is a direct cause and effect relationship between adverse childhood experiences, those things that happened in the past are very much affecting your present health today. And even to the extent where we know that people who have, I believe it's 6 or more ACEs have they live on average about a 20-year shorter lifespan. Their health is impacted across all domains that they've been able to measure. So we know that it's really important for us, for our health, current day health, to consider how important it is to address trauma in the present, because it is still active. We also understand, and part of that is recognizing the generational impact. Those things that happened from far in the past are still present today. Recent research in epigenetics with Holocaust survivors has gone to show us that in the genes, we can look and we can see how our genetic profile, the way the genes are expressed, gets changed after trauma. Holocaust survivors, the next generation of Holocaust survivors is changed after experiencing trauma. So trauma does change from one generation to the next, and not just experientially and socially, but also genetically. We know that there are a lot of different impacts from, as again, Pearl gave a great example earlier, talking about how when you grow up in an environment that there's a lot of struggles, it's going to impact the next generation and then the next generation, and it impairs your ability to be able to have enough resources to carry forward for the next generation. And then we also know that healing is not time limited. So healing is something that's going to take, it takes as long as it takes. So it's not something you can, put a cap on where it's been 6 months, where it's been a year. Healing often, healing is something that's going to take, sometimes it's a lifelong process of helping people to find their best selves. So trauma matters. Addressing trauma in the present, it matters, which is why we're going to talk a little bit more about the impact of trauma. Go ahead and flip to the next one, and Karen will pick up on the next slide.
Hello, I'm Karen Rich, and I'm going to pick up on the topic of what is trauma. So when we refer to trauma, we're referring to an event that's outside the range of normal human experience that causes someone to fear for their life or the life of somebody else. And the list that you see on the slide are some examples of this. And in addition to those characteristics, the situation overwhelms the individual's coping capacities. So when we think about it, one's coping capacities may vary by age or experience. So what traumatizes me may not be the same thing as what traumatizes you. But the trauma is the reaction that the person has in their mind, their emotions, and their body. So typical effects of trauma include isolation from other people, re-experiencing the trauma, perhaps in the form of flashbacks, dissociating sometimes from trauma, from triggers of trauma or reminders of trauma. Dissociation involves spacing out and sort of leaving one's body, which is a learned response to inescapable terror. In addition to those key components, there are other factors that may or may not happen when someone has been the victim of trauma, one of which is memory impairments for the traumatic incident, self-harm to manage the effects of trauma, such as to manage dissociation or the re-experiencing of the event. Self-harm can be helpful with that. Self-medication, which can be through food, through alcohol, or any other substance. And the effects can include emotional dysregulation or the inability to modulate powerful emotions of anger or terror that can occur. Next slide. So these are some of the warning signs of trauma, and I believe that I've sort of mentioned them as part of the symptoms of trauma, but sudden unexpected anger in certain situations, incredible distrust in a situation where that normally wouldn't be expected, fearfulness. Other things for children can include not wanting to change when they go to gym, not wanting to be visible, which can include not wanting to stand in front of the class. Children can feel like the trauma is somehow written all over their bodies. So some people wear very big coats or try to, in other ways, hide their bodies. Some people are truant from school because they're afraid to be seen. There are so many different indicators of trauma that you have to be open to the possibility that any student may be experiencing trauma when they exhibit a sudden change in behavior. Next slide. So trauma-informed care has many facets, and we want to use trauma-informed care in the institutions that exist to help survivors. So that includes hospitals and schools and criminal justice organizations, any place where people may go, including homelessness shelters, etc. So in order to provide someone with trauma-informed care, it's very important that the staff are knowledgeable about trauma so they can notice some of the symptoms that we've been talking about among the clientele. So every single person, not just clinical social workers and psychologists, but every single person within the institution would need to have some basic understanding of the symptoms of trauma. And in addition, somebody should survey the agency and look around and say, wait a minute, based on the fact that people coming in here have a history of, say, domestic violence, maybe we shouldn't have all this screaming and yelling taking place. In other words, to look over the institution and to say, what are some things that are happening here that could actually set somebody off who has a history of trauma of the type we're here to actually help with. So one of those things, in addition to that, is to eliminate triggers if you can. in the environment once you identify what they are. One way to identify them is to have somebody who has a similar history, who may be a client even, to walk around and talk about things that are in the environment that could actually set them off. And sometimes you can't modify everything, but you try to modify as much as you can in the environment and in the protocols. For example, medical organizations are now requiring less disrobing because they're aware that sexual assault and physical assault survivors may be uncomfortable in a situation where they have to disrobe for medical procedures. So now it's done only when it's necessary in the more trauma-informed medical facilities. So changing things around to make them more comfortable and to feel more safe for the clientele is important. In addition, offering choices. So the feeling of helplessness and powerlessness that survivors have during the incident can translate into feeling that way, you know, in a helping situation as well, especially if they're being asked to talk about it. So giving them as many choices as possible can help to mitigate that. So choices can include, if possible, the gender of whoever is providing the service, the timing of the service, the location of the service, and even the methods being used where there are options. And really letting the client know of the various things we're asking you to do here, which ones are optional and which ones are absolutely essential. So for example, a client that is terrified of injections might be told that you don't actually have to get an injection or a blood test. You do have to sign a disclaimer, but we're giving you the option to not do that if it's something that is that upsetting to you. And we will still provide you with medical care. Another thing that's important is the ability of the client to provide feedback. So clients are not necessarily going to voluntarily comment on the services they're receiving. They're more likely to just leave and never come back and be considered non-compliant clients. But if they're asked, what are the things happening in this organization that make you feel better and safer? And what are the things that we do here that make you feel threatened or less likely to return? Clients are more likely to respond if given that opportunity. It's important to have members of the client population on the board if you can. And another part of trauma-informed care is that one size does not fit all. So flexibility with the protocols is very important. And last but not least is cultural competency and disability awareness as well. So treating people of different cultures with a kind of sensitivity to their norms and expectations can be very helpful in terms of trauma-informed care, because people have often been the victims of trauma because of their differences, right? So they may have been bullied, or they may have been excluded or subject to different types of abuse. They may not actually count as physical violence, but it's considered institutional violence. These people may be particularly sensitive. And what this does is focus on trauma-informed care is more likely to retain clients. It reduces dropout. Having staff supervised and trained will reduce the amount of burnout that they experience. So the staff benefit and the client's benefit and the service provision is likely to be much more effective when these protocols are observed. And the last thing I want to mention here is secondary survivors. So Susan O'Million talked about being the secondary survivor of murder, right? So somebody in her family was murdered and she then becomes somebody with secondary trauma. So the same thing happens with people whose family members have been raped or bullied or victimized in other powerful ways. And what happens is those people, the loved ones of the survivors, have their own set of symptoms. So a truly trauma-informed agency will provide services to those people as well. Because when those people are given services, particularly if they're parents of children, the primary survivors are going to do much better because they will have people around them that know how to respond to them appropriately and help them feel safe. So trauma-informed care is a buzzword that you hear a lot, but it's got a lot of complexities and a lot of components that are really important to focus on if you are an administrator of an agency. Next slide. Which will be Megan and Garza.
Yeah. So thanks, Karen. Now, that begs the question. So we understand what trauma is and some of the impact of it. How can you help? This is often the struggle that people get in. So there are a few things with just understanding about just the impact on the body. We want to be able to regulate the impact of what is happening to you physiologically when you're impacted by trauma. Either and this could be if you're the person directly impacted by it, or if you're a helper, if you're a family member. There are lots of different ways in which self-regulation is important. You can do this by offering a person a glass of ice water to regulate their body. This hits on that the vagus nerve. That vagus nerve helps to re-regulate and set the system. So it kind of helps, it helps to ground the person back in the present. Deep breathing is also something. So we often talk about helping connect somebody to there's different kinds of breathing. You have breathing in your chest, and then you have breathing in your diaphragm, what we call belly breathing. So taking deep breaths into that belly. So you're moving your hand, not so that the hand on your chest moves, but so that the hand on your belly moves. And doing a series of that, several real nice, deep belly breaths. And going through coaching with them, there's a lot of different kinds of breathing exercises where we have square breathing. So you can counting to 5, as you're breathing in, holding, exhale, holding, and kind of going, like you imagine yourself making a square as you're going through that process. There are different ways that you can do breathing exercises, and there are lots of different apps that can take a person through on the steps of doing that. But you also want to just kind of help the person stay in the present moment. So help the person kind of be mindful about where they're at, trying not to get them stuck back in the past about what happened, but be in the present. So anything that helps ground them in this present moment where they're at right now with you, where they're safe, reminding you're here with me, you're safe, you're just notice the things that are around you here in this office. Notice the lights, the sounds, take a mint, put it in your mouth, just feel your feet on the ground, feel your feet in the shoes, just notice what's here in the present. Encourage them to you're going to want to listen without judging. So a lot of times people, they just want to be heard. So not asking why questions, not interrogating them, just give them space to tell you what they need to tell you, and bear witness to their pain. So silence, being a silent observer in that way, and just hearing them out and validating what they're saying. Like, that's awful. Thank you for sharing that story with me. Like that. I can't imagine what that was like. Like I really appreciate you sharing this with me. Now, you also want to give them space to talk if they want to. Thank them for sharing. Accompany them to a safe space. And we also want to help them get set up for doctor's appointments, lawyers, advocates, therapists, help refer them to other professionals who can help. Look up any resources and offer ideas for coping skills, and get yourself help for any indirect trauma that you may be experiencing. Okay, we can go on to the next one. Some places where you can get help. You can get help from the National Suicide Prevention Hotline. RAIN.org is really good for finding sexual assault resources all across the country. There's a Valley Against Sex Trafficking. National Center for PTSD has a wealth of resources as well, where you can learn different treatment methods for recognizing symptoms, signs of PTSD, medications that are helpful. Just it's a great resource. And the National Child Traumatic Stress Network has a lot of really good tools and articles for helping out children and families who are affected by trauma. And then, as well as this link on how to get help is helpful with local resources in Pennsylvania. Next slide, please. And in terms of how to prevent trauma, so things you can do in terms of preventing trauma, there's preventing trauma in the current moment, and then there's preventing trauma in the past. So listen to your gut, watch for warning signs of danger. That's one of the things that people really struggle with is, what do I need to do? So recognize those signs of when things are dangerous. Put up signs for no-hit zones. This idea of a no-hit zone is where essentially where we we have no smoking signs in hospitals. No-hit zones are this idea where we put up signs in hospitals where we're not hitting children, we're not hitting others. So revolutionizing and normalizing it. Hitting is not okay because hitting is traumatizing. Avoiding triggering social media content. That's one way of preventing trauma and triggering trauma. In terms of bystander intervention, offering a distraction, getting someone to focus on something else. And we also encourage people to tell and keep telling until you get the appropriate response. A lot of times the people who you're going to might not respond in the way that you want to. And in terms of how to prevent trauma, in terms of just the internal response, really make sure to use a lot of those things to take care of yourself, with getting a good night's sleep and trying to make sure that you're eating, and find humor, gallows humor, if so, find humor and laughter, watching stand-up comedians, connecting with family and friends. Social relationships are essential for self-care. And find a place of safety, find places where you can go to for safety, and practice things like yoga, meditation, and deep breathing. All these things are going to be helpful for in the moment and afterwards with preventing trauma. And with that, I'm going to pass it on to the next person.